I guess I'll ask you, how did you determine that the PRP and stem cell was the best thing for me?
Yeah, that's a good question. So as I stated before, all of those things are tools, right? The PRP, the lipo, the BMAC or bone marrow,
Yeah.
even the shockwave, right?
Yeah.
These are all just tools.
Mm-hmm.
It very much depends on how you use them, though.
Yeah.
So what I try to get people to understand is when you read about PRP, right, and that's typically the most common thing that people read about when they have these conditions.
Yeah.
Most of what they'll learn about is just an injection just into the joint space, right? And that can be very beneficial for people, and there are good studies, especially for mild to moderate, say, knee arthritis.
Yeah.
People do quite well. But when you start to get to that extensive point where you've lost all cartilage, and you have those bone marrow lesions, and you have all these soft tissues that are starting to break down, is there some way that we can use those tools to expand what we're capable of doing? So I always encourage people, if they don't have to get treated by me, but if they do go and they talk to somebody about it, ask specifically, are you just putting this into the joint? Or are you going to treat other tissues with this PRP? And I'm not saying that all the tissues that I hit are the way that I have to do it. Other people will approach it in a different way. But I think that we have this tool that's very powerful, whether that be PRP or the lipo or BMAC. We should be able to expand it and hit the tissues that are basically screaming out for help, right? So I kind of start with the individualized targets of what I see with each patient that comes into me.
Yeah.
What is the body telling me? What's the story that's being told to me, right? And how can I improve that? Then when it comes down to that choice between PRP and doing the cell therapy plus the PRP, to me it goes back to that three tenets of regenerative medicine, right? You have your own local cells in there, but oftentimes the tissue that I'm hitting with, say, just PRP relies on mobilizing outside cells to come to that space to start to make changes, as opposed to me being able to deliver specifically focused, good, healthy cells into that damaged tissue, and then having the PRP there to run the show between that communication pattern. So I think that's where that big difference comes in. Now, we still need a lot of data and a lot of research that needs to be done and is in the process of being done, of understanding, what's the best way to go about this and what are the specifics of doing it. But from the studies that we do have and the improvement in tissue that we see of following people up with imaging and things of that nature, we know that these things do and can heal, and it's just the best way of utilizing the tools that we have.
Yeah, and you do follow up MRI sometimes.
We
right?
often do. Just to track and see what we have.
Yeah.
And oftentimes we can actually work with Clearview, or whatever their new name is.
I know, right?
We have a deal through our office to be able to get basically what we call kind of a focused biologic imaging study done, which is essentially not as many frames as you would get on a full MRI, but a limited amount that gives us like a very focused picture of where we treated and where we see those changes being made.
Yeah.